Welcome, ladies and gentlemen, once again to this session. Ginger the Voice would like to welcome you once again as we talk all things COVID-19 tonight. Welcome, ladies and gentlemen. Welcome. Okay, I hope you've had a wonderful week. We are halfway through the week and it's almost Friday. And I suppose during this lockdown, that doesn't really matter because most people are working from home. But nonetheless, it will feel like a weekend because you won't have to open up your laptop, hopefully. But welcome, ladies and gentlemen. We're welcoming you. We'll just give it a few seconds so that people can see. Welcome. Welcome, ladies and gentlemen. If you are here watching us today, can we just see by you maybe liking our post at the moment or just writing something so that we can see how many people are on? Okay, welcome, ladies and gentlemen. My name is Ginger. Welcome. Thank you so much for coming through. We'll give it just a few seconds to allow people to get their connections straight and up and running. But we are more than welcome to come through and we are so excited to have you here. Welcome, ladies and gentlemen. Once again, we meet this Wednesday and we're very excited to have you come through. Thank you, Tando. We can see that you are here, Mrs. Mjambana. We appreciate you. We appreciate you too, Ms. Tato Monjani. Thank you so much for coming through. We appreciate this. We'll just give it a few seconds so that we allow other people to come through and to make sure that their connection is stable here on Facebook. Welcome, ladies and gentlemen. Thank you so much for tuning in. We appreciate this. Hello, Ms. Visuneba. Hello. Thank you. Thank you so much for tuning in. Thank you, Tato. I can also see you. Thank you, Tando. I could also see you. We're just going to start in a few minutes, or rather seconds. We're just allowing people to, get a grip of things and probably to acclimatize to the African time. Welcome. You know how it is, 7 o'clock is 7:10. But nonetheless, we'll wait for just a few minutes so that our people can join us. Today, we have a wonderful topic ahead of us. It's wonderful in terms of it being something that we can overcome. So we've got someone here to speak to us tonight, to just give us hope, It seems like people are living in fear and it's a hopeless situation, and yet there is a light at the end of the tunnel. So welcome, ladies and gentlemen, welcome. Thank you so much for coming through. I appreciate this. Ginger the Voice couldn't come through last week due to connectivity, but we did apologize and we thank you so much for understanding. And here we are again this week and we're very excited to have you on board. Thank you so much. Thank you very, very much. Okay, I think we're going to give it just a few more seconds again, and then we are going to start, whether people are on board or not, because time is something that we need to keep to. Welcome, Boo. Thank you very much for coming through. Welcome. You are welcome, ladies and gentlemen. Dumelang. The English touch is in the house. If we were in a conference room, Mr. Ingle, we would be giving you a standing ovation for all the work that you've done in the music industry. So thank you so much for taking your time. Welcome, 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 Percy. Welcome. Welcome, ladies and gentlemen. As I said before, we're going to talk all things COVID-19 today, giving people hope, as there's a bit of a situation where everyone has just stormed into fear, which is something that we need to fight against, because we've not been given a spirit of fear, but a spirit of a sound mind. And we conquer only when we have a sound mind. So today we will talk to one of the survivors of COVID-19, who also happens to be a doctor, but she'll delve more into it and tell you how she made it through, because we can conquer and we will conquer COVID-19. It's not here to last forever, and we will not succumb to its pressure. We refuse to. We've got God on our side. We've got a lovely future ahead of us, so we cannot just allow it to dim our lights. Not now. We will not. All right, we will start right now. Thank you so much for tuning in. My name is Ginger, and I'm the owner and the founder of Ginger the Voice. We seek to give hope, courage, and enlightenment to the people. We're a communications company, and our vision is to create the best version of you through these platforms. So today we are going to talk all things COVID-19, how to navigate through this wilderness. As much as it is the wilderness, but we can go through it. We don't have to stay in it, and we don't have to allow it to make us sad and gloomy, because there's always a light at the end of the tunnel. So we thank you today for coming through. We appreciate your presence here at Ginger the Voice. And what we seek to do is to give people courage, because what we've picked up is that there's a lot of fear. This thing has just tormented a lot of people with fear, you know, and as I said before, if you are fearful, then you do not have the courage and the strength to fight the battle. So we want to tell you today that it can be beaten. We want to tell you that today that we can overcome this. Ginger the Voice would like to send their condolences to all people who've lost their loved ones through COVID-19. It wasn't easy, but sometimes we need to allow God to do his will at some point, and we need to accept, but we are very, very sorry, and we hope that you will have the strength and the wisdom to continue, because life does continue. Thank you so much for watching. We've got Dr. Nkanyane, who's here today. She has been a survivor of COVID-19, but what I like about her is that she's also a doctor. So she will speak from a perspective of being a survivor of this pandemic and also of being a doctor. So she's got two faces or two sides to this whole thing. That's the most interesting thing about her. So she'll speak from a doctor's point of view and also from a patient's point of view. So today, please stay tuned and enjoy and sip in all the nuggets that she'll be giving to us today through talking about her journey and how she fought the battle and how now she feels and where to from here. So Dr. Nzago, thank you so much. She's studying to be a gynecologist. Well, she's left for the few months up until she graduates to be one. So we appreciate you here. She's also a medical doctor at the Steve Biko Hospital. Together with, she also roams around the Tembisa Provincial Hospital as well. So we're grateful to have you, Dr. Nzago, here. We are so happy to have you because you are one of the people whom we look up to. You are frontline staff. So we want to say thank you, and then we do appreciate that you put your life and that of your family in danger to ensure that South Africans are healthy and they have what they need so that they can continue their personal lives. So we'd like to hand over to you, Dr. Nzago, and that you just tell us how did you come across to hearing that you actually are infected with COVID-19, and as a survivor of COVID-19, just take us through your journey up until you tested negative.
Okay, thank you so much, Ginger, for having me on to the show. So the journey with COVID-19. So initially when we're preparing, for the cases coming in our various departments. So the plan initially was who would volunteer actually to be part of the COVID teams, so that those will be the people dedicated to dealing with patients who test positive with COVID. And surprisingly, most of us were like, no, looking at what was happening abroad, how the health system was overwhelmed, how the doctors and people who actually work in the health sector were overwhelmed, and how they were getting infected in that. So most of us were like thinking of our families, thinking how young we are, and we're like, oh, no, it's fine. We'll deal with the other patients, but maybe other people can volunteer. But actually, as the cases started coming in, then that's when we all had to actually come together and work as a unit. And that's actually when you remember your oath as well that you've made as to why you're actually in the medical field. You want to help. You want to help people. So we were then all prepared. We started preparing, the whole how to deal with COVID, as the hospital virus departments as well, were sections as to which ones will be the COVID units, and then also preparing on how to put on our PPEs and all that. And so when I actually tested positive, we actually had a few patients in our department that were actually waking up for COVID. So they came in with symptoms who had done the tests and were just awaiting results on those patients. But surprisingly, how I got tested. So one of the doctors that I worked closely with tested, and her test came out positive. So I was a close contact. So she phoned me when she got her results. And said, my tests came out, I'm positive for COVID. So because we worked together, I suggest that you go get tested as well. So it was actually late that of the testing stations were closed, and I was like, I can't drive back to work to test. I'll just go to the nearby testing station so that I can test in the morning. So that's when the anxiety actually starts. But I tried to be calm. I'm like, at that point, I was not symptomatic, so that was reassuring that, I'm sure it will come out negative and, and whatnot. So I go the following day to one of the nearby testing stations. I get tested. So when I drove in, I had a heater on, So when they take my temperature, it's like 39, and I'm like, whoa. What's happening? It can't be heater. Just switch on your heater, open the window. I'll come back and take the temperature again. But it's such build up anxiety have COVID, before you even get the results. So I did the test, and my results took long. At that time, actually, there was a backlog. So they actually took 3 days to come out. So when I did the test that day, I was fine. I was not symptomatic. Day 2, I was felt like I had a bit of flu, just a sore throat. And then I was like, maybe it's just flu. I mean, it's been cold. I was on a call the previous day. So, I thought, it can be, I was hopeful then. And then on the 3rd day, that's when I started feeling tightness of the chest. My chest felt very tight. There were periods where I'd actually struggled to breathe. And that's when I became more anxious. Okay, what's happening? Maybe I actually might have COVID. But I just took it as that, what, let to worry, let me not get too anxious, just wait for the results first. And then I'll deal with the results when they come out, and whatever result is, whether positive or negative. So strangely, so I got the results around 2 a.m. in the morning. So I kept checking my phone, like whenever I'd wake up at night, go to the bathroom, I'd check, have the results come through, have they sent an SMS yet? What's happening? So 2 a.m. my phone, I got a notification. So I opened it eagerly, which I regret. I think I should have just waited until the morning. So I got a notification and it said COVID results positive. And, that's when I think for a moment, after reading that SMS, I felt paralyzed,
Yeah.
and I read it again, and it said positive. And, I got up, I went to the kitchen to have a glass of water. I came back and then I read it again and it still said positive. And I woke my husband up then and I said, oh, babes, the results are in and I am positive. And funny enough as well, my husband also was starting to have symptoms,
Sorry, so your husband, sorry, so Doc, you're saying that your husband was starting to have symptoms such as, if you could just give us an example.
Yes. So he was complaining of fatigue, like he felt very, very tired. Even though he was, he was on lockdown, working from home, hasn't out of manual labor or anything like that, but he had muscle aches, he had a headache as well. So, and that was actually the afternoon before I got the results in the early hours of the morning, So now I was also starting to worry about him that, what if he...
Sorry, Doc, again, can I just cut you there? I need to understand. So he had the symptoms, but you didn't have the symptoms.
So my symptoms were milder than his.
Okay.
So I just had the tight chest and I had the sore throat, but he had the muscle aches, he had severe fatigue as well, which I didn't have. I was still able to walk around, and prepare a meal or something for us to eat, things like minor things in the house. But for him, he just wanted to sleep because he was like, I feel so tired. So his symptoms were a bit more severe than mine at that time initially. So, so I got the positive result and then I told him and he's like, oh, I probably have it as well because the symptoms were there. And I was like, yes, you do. You probably do have it because the symptoms are there as well. And the plan was for him to go get tested as well the following day. So after getting the positive results for the whole day, very overwhelmed, like I could hardly do anything. And like you're saying, it's such a mental thing, that you deal with initially, that now that I'm going to die, which is what goes through most people's minds when they test positive. And being a healthcare worker and being exposed to critical care patients on ventilators in ICU, that's the picture that comes to your mind. But, is that then what's going to follow with me? Am I going to end up in ICU, ventilated? Am I going to die this young? That's what was going through my mind, that, oh God, am I going to die this young? Is this the end of my journey? And, as much as people say in the healthcare sector, you're a hero, but at that time, I really didn't feel like a hero, especially now, the fact that now my husband has COVID as well, which probably I brought it home, from work. Then you feel the guilt. I think that's something that weighed me down, that, I've also now infected my husband. What's going to happen? So it was such a mental challenge at that time. And another challenge that I had the following morning was, how do I then tell my other family, my extended family, our mothers and our sisters that, we've tested positive for COVID, and not so much the positive part of it. They also have their own understanding of you die, so now you don't feel now that you've tested positive for going to, because then it's going to be a mental challenge for them continuing from that. So gather the courage, phone to my mom, both our mothers, and then I informed them that we tested positive for COVID. But I assured them that we are not so sick. I was like, no, we have mild symptoms. It's just a sore throat that we're having, so that they are not so worried. Because, another challenge is that once you test positive, you're supposed to be isolated. So your family can't come and see you. And they are the people who will drive any time of the day. If you complain about a toothache or something like that, they will drive just to come and make sure that you are fine. So now you're telling them that you're positive for COVID and they can't come and see you. for them, it was such a mental challenge as well. So just to reassure them, you'd downplay how you're feeling. You'll be like, no, but otherwise we're fine. It's just a sore throat that we're having, and, a cough now and then. And, also speaking to them on the phone, you try and be positive and not sound sick, so that they don't pick it up as well. So that was a challenge. And them phoning every day and asking how you're doing, and just having to be strong for them was something that actually we had to do consistently. So, however, so that was when we tested positive immediately. And then the following day, that's when actually we, both of us and myself as well. So from my side, that's when the muscle ache started and the fatigue started, because I didn't have that initially. So I felt very tired. I just wanted to sleep the whole day. You lose sense of taste, like you eat something but you can't taste what it is. Whatever you eat just tastes the same, it basically tastes like water. So you lose your appetite, you lose your taste, and I still continue to have the tightness of the chest and the difficulty breathing. And as you're having difficulty breathing and as much as you want to sleep, the challenge is, if I sleep, what if I die on my sleep? So you want to rest, you want to sleep, but at the back of your mind, there's that fear that, oh no, I need to keep breathing. I need to make sure that I'm actually breathing, that I'm getting oxygen into my system. Because if I'm not consciously doing that, I might not wake up. So you try to rest, because it's one of the recommendations. We say, you must rest as much as you can. But mentally, you've got this fear at the back of your mind that, I must keep awake so that I can keep on breathing, make sure that I don't die in my sleep. So there's a lot of mental, battles that you have to overcome. And one thing as well that I tried to avoid was social media. I tried not to follow the statistics as to how many people are testing positive, or rather, the deaths that were happening, because that just makes you feel worse. You actually think, oh my goodness, am I next? Am I gonna be the next person on the death statistic? So we ignored that, and we just tried and be positive. And it was, us being positive was, I wouldn't say, it's strange now to say it was a blessing in disguise, because then we would encourage each other better, and you would actually emphasize with each other better. And going through this journey with my husband, I actually think it made it better, as opposed to maybe if I was positive alone. As much as I felt the guilt at the back of my mind that he's because of me. So day two, on the following day, the next 2 days were the toughest, where the symptoms actually got worse. But we tried, because we know there's no cure, just drinking lots of water, eating healthy, and taking multivitamins, and some Panado for fever and for muscle aches as well. And what really helped was the friends and family that will call in just to check on how you're doing, I think what really helps is that, people actually phone most of the time to say, how are you feeling? Are you having any cough? Are you having difficulty breathing? But I actually find that it was better if someone just phones me just to have a chat, like just phone me, but let's not talk about COVID, because then you're making me more aware of the symptoms. Now I really have to listen that, maybe I do have a cough, maybe I do have difficulty breathing. So it's just of note for people who are listening that, if you know someone who's positive, it really helps, not just when you check up on them, just, if they, you've got something in common, or you're reading a common book, however, talk about the book and something else, just to lift their spirit up, just to take their mind off the symptoms that they're experiencing. Because, the more they tell you how they're feeling, actually, the more they feel those symptoms and they actually feel more sick. So I think that helped me a lot to actually get through this battle. And So fortunately, we never had severe symptoms to actually need hospitalization, to actually hospital to be admitted. It was just 3 days of those symptoms, the muscle aches, the severe fatigue, the loss of taste, loss of appetite, and the sore throat, and the difficulty breathing. And around day 5 of having tested positive, that's actually when we started feeling better. The muscle aches were gone, the fatigue was still there, the tightness of the chest was still there, but it was milder. And then eventually it got until the end of the 14 days, when I actually had to go and retest because I had to go back to work. So I went for the retesting, and fortunately it was negative. But I must say though that one thing that that made me pull through was actually being positive. And, you know, in medicine, when we talk about management of a patient, there's a biopsychosocial spiritual approach to it, you know. So yes, you focus on the biology, the physiology, and taking medication, whatever is prescribed and all that. But there's also the psychological, the social, and the spiritual. For me, the spiritual is actually what pulled me through. You know, I think if it was not for my faith in God, I would have succumbed, because initially when I tested positive, yes, I had a period where, you know, they say the person is made up of the spirit, the mind, and the body. The body will feel the symptoms. It will experience the symptoms. Your soul will then feel depressed. You know, you'll have the fear, you'll have the anxiety. That's how it responds to it. But the most important part is your spiritual being, which I believe. And that actually influences how the biology and how the soul actually responds to such challenges. So, you know, when I tested positive, was, God, I am not gonna die. I was, you know, thinking that I have not lived my purpose in life. I still have so much to live for. Like you've mentioned in my bio, I'm currently specializing. I'm like, I can't die now. I think the plan, Lord, was to finish this specializing and then continue practicing as a gynecologist. So this can't be the end of it, you know? And there's a scripture that you actually mentioned. When you said it, I was like, oh my goodness, I was going to say that. You said it for me, that we haven't been given the spirit of fear. You know, I was saying that scripture every single day, that, you know what, you have not been given the spirit of fear, but of a sound mind. So whenever I'd have the negative thoughts, whenever I'd think of the patients that I've seen in ICU being ventilated, you know, even from past experiences, and patients dying from having respiratory illnesses, I would, you know, just say that scripture that, you know, I will not fear. Because once you start fearing, once you start dwelling on that, that's when actually you feel more overwhelmed. And that's when even your body, because what you think physically, you know, there's neuroendocrine, like biologically you secrete hormones that actually even make you feel more ill, you know. So if you dwell on the negative, your body will also react with stress hormones that will actually make you feel even more ill, even feel even more depressed afterwards, you know. So there's actually a link. So I just meditated on the word of God. I prayed. And, you know, another scripture that really pulled me through was the one that mentions that there's no fear in love, but perfect love casts out all fear, knowing that, you know, the love of God for me will overcome the fear that I feel, and it will overcome the experience of COVID. And as I believe that God has, I still have a purpose to live. This is just a phase that I will go through, and I will have a testimony, and to strengthen other people, you know, and I will beat this. And that really, really pulled me through. It really did. And also having a support system of family, friends, and church members that actually pray for you, actually helped me pull through as well. So
Doc,
it was.
you've sorry to pat you to interject. You spoke about you found it a blessing that you and your husband were in this together. So what I wanted to understand from you, what advice would you give to single people? Because there are people out there who don't have spouses. They are alone during this lockdown, and let's just say they wake up and go test and then find out they're positive. So what advice as a doctor, and also I can hear that you're also a Christian, and as a Christian who's a Bible believer, what advice would you give them? Because you had your own support next door to you. So you walked through this, yes, with God, and also someone next to you. So what advice would you give them? Because clearly what I pick up from what you're saying is that this needs support. This kind of virus needs someone to have a support system. So what advice would you give single people who don't have a spouse or a partner?
Okay. Yes. I hear you, Ginger. As much as you might not have a spouse, but most people have at least that one person who's quite close to them, whether it's a parent, whether it's a friend who they are quite close with. That's why disclosing is very important. I know currently there's the stigma that, if I disclose my status, people will think that it's my fault that I got the COVID, or there's something wrong with me, or I did something wrong, and people don't want to disclose, and people want to go through this by themselves, which just makes matters worse. So have that one person that you can confide in, have that one person who can be a source of support to you, whether it's a friend, whether it's a family member, whether it's a parent or a sibling, but confide in them. Have someone who will be a support system. Don't go through this alone, because when you're isolated, one thing I've realized is that the term itself, that when you're positive, you need to isolate yourself. That actually can really affect you negatively. We felt it as well because we're locked in the house. You can't go out. You can't go out to get fresh air or to the mall, just for a different environment, different scenario. You are literally locked in the house and you can't go out, So having someone who will phone you just to check up on you, just to encourage you, that actually impacts positively on your recovery. So as single as you might be, but do not go through this alone. Disclose to somebody. Confide in someone that you trust, and who can actually walk the journey with you.
Okay, all right. I also wanted to know from you, Doctor, can you just paint out the situation in the hospital so that you can give more advice to people who are still living a careless life, regardless of the fact that we've been warned and given precautionary measures? What is actually happening in your Steve Biko hospitals? What's the scenario out there? Like, how does it look like? And so that we can be encouraged to actually do the right thing so that we don't land in the hospital.
Yes, it's actually a good point, a good question that you're asking. And this does not just apply to the hospitals where I'm working now, but most of the hospitals actually in the country are overwhelmed, because as you can see, the number of cases are going up. There's a lot of positive cases. There's a lot of people who need hospital, who need critical care support, because when you have the symptoms, you either have symptoms or you have mild symptoms. So once you've got the severe symptoms and you need to be in hospital, you'll need support in a high care or in ICU. And even before COVID, our health system was struggling. So now the struggle is way above the capacity that our hospitals can take. The health system is overwhelmed. Care systems are full, and surprisingly, even in the private sector, we used to think that if you've got medical aid, you'll be better off. You can go to a private hospital and you might get access to ICU. But we're actually seeing that even some of the private hospitals are actually closing down because their ICUs, their high cares are full, because of the high numbers of people who actually need high care or ICU support. So they always say prevention is better than cure. Yes, it's difficult with COVID because of how it spreads spread so quickly, how now they've even discovered that it's an airborne disease, accounting for the many positive cases that we're having. But the measures that are there to at least prevent people from getting infected. Staying at home and only going out for essential services is very important. I know with the easing of lockdowns, we actually got the false impression that things might be getting better, but actually not. As you can see, with the ease of lockdown, the cases went up. I heard on the news this morning when I was driving back from work that there was a study that's done the cigarette regulations, people are actually sharing cigarettes. There's a high number of people who are actually sharing cigarettes as they smoke. And, such behaviors, and they actually think that it's also contributing to the high numbers of positive cases. So it goes to we have a responsibility as a nation. It's also for your safety and for the safety of your family as well. Like I felt it, I spoke of the guilt that I felt, that what, and then I brought it home, and then my husband is positive. Fortunately, it's just the two of us in the house. But just imagine those who live with extended families, who live with people in their highest, who are at more risk of getting COVID, elderly, the elderly above 65, or other women in the house who may have other illnesses like diabetes. So it's those people that we actually need to think of as well. If you can't do it for yourself, at least do it for your family. At least do it for your grandmother in the house. Do it for your siblings in the house and protect them. Because by you adhering to the lockdown regulations and keeping safe, you're actually protecting them as well. It's a battle that as individuals we cannot do it, but we need to work together. As a nation, we need to work together as a community if we're going to win the battle of COVID. The healthcare sector can try what it can, with getting a lot of equipment. Unfortunately, like China, we don't have the resources to build a hospital in 7 days. That's something that we have to bear in mind, that our resources are limited. Hence our behavior as well. We really need to be careful as to minimize the rate of infections and the spreading of the infection in our communities and in our homes.
Doc, can someone who's been a survivor of COVID-19 be reinfected with the virus? Say, for instance, you're now going back to work and you've tested negative now, but is it possible if you're exposed to other patients who are COVID-19 positive for you to get it again?
Okay, that's a good question, actually. So initially, there were studies that showed that there's immunity. That once you test positive for COVID, you will have immunity and you won't get infected again. But now there's newer studies that were done on people who actually had the infection. And they found that the immunity is not lifelong. So the immunity wanes over time, lasting for different lengths of time on different people. So they found that those who actually have more severe disease are more likely to have longer immunity. It might not be lifelong, but it's actually longer than those who had mild symptoms. And days for like 50 days and 90 days for some people. So believe that there's immunity, but it's not life. It's for a few months if you've tested positive for COVID. So as much as I had COVID now, I can't walk around without the mask, without the protective wear, and with the assumption that I'm safe, I have immunity. I still have to act like someone who has never had COVID, because the chances of reinfection are there. Because the challenge with COVID is that it's a different virus. We learn something new about it almost on a daily basis. What we know today is not what we knew yesterday about the virus, and what we're going to still find out tomorrow, it's probably not the same as what we know today about it. So we just have to keep up with what is being discovered and adjust constantly to the new information that we discover about the virus. And,
Okay.
you know, as you mentioned that as well, there's something that I wanted to say, because like on social media, almost on the different WhatsApp group that I'm on, there's actually, you know, messages that are going around about what people should be taking for COVID. You know, there's different mixtures, different you know, saying, you know, to prevent yourself from getting COVID, you must drink 1, 2, 3, 4, 5. Or if you test positive for COVID, you must take 1, 2, 3, 4, 5. You know, and I just want to caution people as well that, you know, to actually be careful of the advice that you get about what you can, especially if you're going to take something orally into your system. Things actually that have not really been confirmed whether they're effective or not, because some of the things can actually be detrimental, you know. For some of the things, there's no scientific evidence for it. So just to be cautious as well, not to take everything that is circulating and start practicing it. If you can get medical advice as to whether it's the right thing, the right concoction to make or to drink, rather do that, because there's a lot of things that are circulating on social media and that have not been proven that can actually be more detrimental to people's health or not. So people just have to be careful.
Okay. On that note, Doc, of you talking about the preventative or the medicine that we can use to treat it, can you give us a list of a few things, maybe of the items that we need to buy and have for those who are COVID-19 positive, and as well as if there are any for those who are not yet COVID-19, what is it that they can use to boost their immune system?
Okay. You know, one thing actually that I realized with COVID is the health of individuals, you know, that being healthy actually is a benefit, and having lived a healthier lifestyle even before the era of COVID is actually now of advantage to you, because your immune system is stronger. You are more likely not to have the comorbidities that actually put you at risk of getting COVID. So before I answer your question, one thing that I have learned is even beyond COVID, you know, I would really encourage us as individuals to actually live healthy lifestyles, you know, just to make sure that your immune system, your body it's always at the optimal health level to be able to fight off any infections that actually might arise as you know, as life goes on in this journey. So basically, usually, as we know, currently there's no cure for COVID. So if you are not positive yet, you just have to remain healthy. You know, there's no really preventative measure that you can take to prevent yourself from getting infected, you know, but just making sure that you are healthy, that you eat healthy, you drink lots of water, you exercise if you can. That is actually is a bonus. That if you have any chronic conditions like HIV, diabetes, hypertension, that your conditions are controlled. That you're taking your medications as prescribed. If you're diabetic, because we're finding that actually the diabetic patients are the ones at a higher risk, that your diabetes is controlled, you go for regular follow-ups, that actually will be of benefit. And actually they're finding out that people who actually have a higher weight are also at a higher risk. So working on having a healthy weight can actually be of advantage to you. And when you do test positive, as I mentioned, there's those with mild symptoms that can actually need to self-isolate at home. And if they have mild symptoms, basically it's just to observe the progression of their symptoms, because whether they're improving or whether they're getting worse. So actually checking your breathing constantly. If you start to breathe fast, if you start having difficulty breathing, if you persistently coughing up blood, then those are indications that you should actually go to hospital to seek medical care, so that they can do further investigations and tests and see if you need supplemental oxygen or not. If constantly you're having fever and it's not coming down, also it's something that you can look into. And also we advise multivitamins just to strengthen your immune system. Multivitamins, taking vitamin C tablets, which you can actually get at a pharmacy. Vitamin C, vitamin D, can actually boost your immune system. If you actually consult for COVID symptoms, like currently we actually prescribe some antibiotics that a person can take, like augmentin or azithromycin, that actually have been found to be beneficial. But for that, you actually need a doctor's script for it. And also, yeah, so that's only if you have consulted a doctor and they write a script for you. If they see that it's necessary, then they can add the antibiotics for you, but it's not something that you can get over the counter. And then also people can take Panado, which is you can easily actually get over the counter for any fever, for any the muscle aches, the pain that I might be experiencing. As I've mentioned, it's something that I used as well, that I took just to help with that. And that's actually what people can take if they test positive for COVID.
Okay.
The other concussions, there's actually no scientific evidence for it. Hence, I will not mention them.
Okay. I suppose you talk about Nkanyane, our most famous one here in Africa.
Yes, I'm going to avoid that.
No, it's fine, Doc. I just have one more question for you. Can someone who's been exposed to people who have tested positive for the COVID-19 and remain negative, is that possible? Say, for instance, they've been singing with these people or their colleagues and they're in constant contact with them, but he or she remains untouched by the COVID-19, but the rest of them test positive. Is it possible? Have you ever had such cases? And why is that?
Yes, so it does happen. So it depends on the close contact that you had with the person, and also when the person tested positive, how symptomatic were they? Because if they were symptomatic, then the shedding of the virus was higher. So it can happen that the person can test positive. I think that's why we also find that with children, newborns, for example, even though the mothers can be positive, but they tend to be less infected, even though they stay with the mom and they breastfeed with the mom as well. But something that we need to, someone like that actually has to monitor their symptoms quite closely, because as much as the tests that we're using are quite accurate, you can get a false negative as well. So if they believe the contact with the person was quite close, which usually they say within a meter, and they were not wearing a face mask, that's considered a close contact, and they go for testing and it's still negative, they should actually monitor their symptoms, because it can be a false negative test. So if they do start being symptomatic, then they must actually go for a retest.
Okay, so are you saying that mothers with newborn babies can actually breastfeed and it's not dangerous if they are test positive? Is it? Oh, that's lovely. If they test positive for COVID, then they can breastfeed. It's still a safe gesture.
Yes, it's safe. That's actually what we advise our mothers. So it has been found that newborns actually don't get infected with the virus from the evidence that we have at the moment. Okay. Newborn mothers are actually not separated from their mothers. The mother just has to be is consult on hygiene. So before they breastfeed the baby, they just have to wash their hands, clean the breast as well, always have a face mask. That's very important when they're breastfeeding. And after the whole feeding process, same thing, they hand hygiene and then clean the breast again, because it has been found that babies actually don't get infected with the COVID, so they can breastfeed. But the mother must always have a face mask on whenever they are with the baby in the same room. So that's actually, it's safe for the baby.
Okay, all right. Doug, could you just say maybe last words to the rest of South Africa who are watching today? Some of them are already infected. Some of them actually got their results today or most recently, and they're still fearful. They're still scared. What advice would you want to give them as you conclude this talk tonight? And what would you like to say to them as a survivor of COVID-19 and also a Christian and also a doctor?
Okay, so COVID is not a death sentence. Just because you test positive does not mean that you're going to die. I think that's something that we need to understand. And disclose, talk to somebody. You know, when you talk to somebody, you're actually, you will feel better emotionally, you will feel better psychologically, and people actually offer you support. Another thing is that you know that once you test positive, you can't go out. You can't go out and get any medication that you want to get. You can't go out and get food. So you need a support system of people that can actually help you get those things and bring it into your house since you can't go out. So support system is very important. But someone who will also be offer emotional support to you, encourage you as you go through the journey, because it's not easy mentally. You know, constantly you have the feeling at the back of your mind that what if I die? And every day that passes by and your symptoms worsen, maybe you feel something that you didn't experience the back of your mind thinking, what if this is it, you know? So something that will just speak life to you, you know, someone who will just speak positive words of encouragement, because sometimes you feel so weak, you feel so tired that you can't pray for yourself, that you can't encourage yourself. So if you've got someone who can actually stand in the gap for you, to help you get through that journey, it's very helpful. So and confined in someone, get someone that you trust to go through this journey with you. That's the second thing I'm going to say. Avoid statistics, you know, avoid looking every day who is dying from COVID. You know, avoid reading such things, avoid the news about COVID during that period, because as you know, the numbers are going up, the mortality, people are dying as well, the numbers are going up. But on a positive note, there is almost 52% to 53% today of people that are recovering from COVID, which is quite, which is a positive point. So avoid the negative statistics, because that will just depress you more, and you will just feel that you might end up being one of those people on the negative side of the statistics. So avoid reading the negative news about COVID, and stay positive. It's very, very important. I believe if you can win in your mind, that can actually translate to your body. It can actually translate to the physical being, and you can win in your body. You can conquer the COVID in your body if you win in the mind. So don't go and commit suicide because people think that they will die in less pain. If they just kill themselves before the time comes, where they don't have to be attached to machines to help them breathe and all that, because it really is not a death sentence, you know. So we can conquer, you can go through it, but you need to be quite positive in your mind.
Okay. Ladies and gentlemen, there you have it from Dr. Nzako, a survivor of COVID-19 and also a doctor who is a Christian. She has told us today that she used God as her source of strength, and she had her family as a support system. So do not be afraid to open your mouth and say that, hey, I'm in trouble, I need your support at this point in time. And do not be afraid of stigma. In fact, #no stigma. This is utter nonsense. We cannot say that to people who have been infected by COVID-19 and start having an attitude against them because they did not apply for it. It's a pandemic that has swept the nation by surprise. It all caught us by surprise, but not all is lost because there are more cases of survivors than those of people who are dying. But with that said, ladies and gentlemen, please keep to the precautionary measures that we've been given. Please do drink the concoctions that have been set by the doctors, and please do keep at home, stay safe, and don't move around a lot because the COVID-19 moves with the people. Okay, thank you so much, Dr. Nzago, for your time. Thank you so much that you're also one of the frontline staff members and you've sacrificed your time, your energy, together with that of your family to make sure that South Africans are well and that South Africans are well taken care of. We truly appreciate you guys, all doctors out there, nurses working day and night to ensure that our health system runs properly. Ladies and gentlemen, that's all that we had for tonight. Thank you so much for tuning in. My name is Ginger and I'm the owner and the founder of Ginger the Voice. We're here to give you hope, courage, and enlightenment. Our vision is to ensure that we create the best version of you. Have a good night. We'll see you next week, same time. God bless you.